Hi guys, it's Louis from MDXtesting.com, the channel where we give you medical care solutions and bring you diagnostic information so you and your family could be healthy. Now, let's face it and let's be honest. And we could be a millionaire, a billionaire, and we could have real estate investments and money in stocks or crypto, have yachts, whatever it is that we might have. But if we don't have health, then we don't have anything. So this is what this channel is going to be about. This channel is going to be about bringing you the latest medical diagnostic components so you can make good, solid decisions, and you could use preventive measures to take care of yourself. Now, with that being said, let's get started. Now, today's video, it's going to be about cervical reticulopathy. Now, what is cervical reticulopathy? In simple terms, well, it's when the nerve in the neck it's affected. Now, any clinician or any physician hears the term cervical reticulopathy, they're going to know that that pertains to your neck. Now, one of the things that you have to know, just for your own personal education, that the vertebrae or the spine is really divided into, it's 4 different parts, but 3 major parts. The neck, which is the cervical spine, the mid-back, which is the thoracic spine, and the lumbar, which is the lower back. Okay? So when the term cervical means it pertains to the neck, and reticulopathy is the disease or the neuropathy of the neck. For instance, neuropathy, what does neuropathy mean? Neuropathy means nerve disease. Neuropathy means it pertains to the extremities, upper or lower extremities, anything that has to do from your shoulders to your fingertips or from your hips to your toes, that's neuropathy. So reticulopathy is the neuropathy of the spine, and it's when the nerve is compromised. So another thing that you want to know, again, for your own personal education, that all the nerves you have from your shoulders, when it comes to the upper extremities, right? All the nerves you have from your shoulders to your fingertips originate from the neck. So the neck is like the fuse box of the upper extremities. Everything originates from there. Now, what are the common causes of cervical reticulopathy? One of the main common causes in cervical reticulopathy, especially in young adults, it's a herniated disc. When the disc is affected. Now we're going to get into herniated disc, bulging disc, and a little bit on the imaging studies a little bit later. And we're going to try to keep this as simple as possible, especially if you're a patient, if you've been diagnosed with cervical reticulopathy. And obviously, once you get a little bit older, if you don't take care of your posture, if you develop medical conditions, maybe some arthritis or rheumatoid arthritis, overweight, obesity, it can affect the spine. Now, one of the things, right, that we've been seeing the last couple of years, in fact, in a medical report that I read a couple of years ago, it says that the new generation of people, okay, meaning us now, okay, we are the generation, are going to suffer from cervical compression syndrome. Why? Well, I wish I had the phone with me. Why? Because almost everyone that you see, and I advise you to kind of pay attention to this, it's like this, looking at your phone. So what do you think is going to happen to your spine if you constantly, year after year, are bringing in your shoulders, bending your neck, always looking down? It's going to compromise the neck. It's going to affect the cervical spine. Okay? So your neck should always be out. Your neck should always be straight. So learning how to take care of your posture, learning how to not do certain things, it's important. When your neck gets affected and you end up with cervical reticulopathy and you've been doing these things, you have not been taking care of your posture, then things could be worse. Now, one of the things that causes cervical reticulopathy, right? One of the things that causes the nerve to get affected. Now, you can get into an accident. Okay, you could be the driver, you could be the passenger, perhaps maybe you got hit by a car. A slip and fall, maybe perhaps in someone's personal or or business property, or maybe you got hurt at work and you hurt yourself. Any type of accident, there's many more accidents. It can affect the spine. And like I said, medical conditions, older age also can affect the spine. Okay, so what happens when you develop these symptoms? You could develop pain on the top of the neck, in the middle of the neck, or the bottom of the neck. You could develop limited range of motion where you really can't turn one way or the other. Depending on the location where that nerve is affected, it can radiate into the shoulder. It can radiate into let's just say into the biceps, maybe triceps, to the arm, to the fingertips. And the two chief exams that you need in order to be able to document a cervical radiculopathy is EMGs. What's an EMG? Well, I have tons of videos on EMGs, and EMGs are nerve and muscle examination. But the muscle examination, it's the most important test when it comes to examining those muscles in the neck. And then you have imaging studies. The imaging studies of the MRI will be able to tell us if the disc it's herniated or bulging disc. So we're going to discuss a little bit of both now. Now, obviously, let's just say you got into an accident and you have a personal injury case, then you will need both an EMG and an MRI. They kind of could support or correlate with one another, and they can document that you might have either a bulging disc, herniated disc, and a cervical radiculopathy at whatever level it is that they found. So usually, cervical radiculopathy gets diagnosed by whom? Well, by the main two doctors, either a neurologist or a physiatrist. They do a careful neurological examination, and they're able to pick up pretty much the location of where you might have clinical cervical radiculopathy. Okay, and obviously, their clinical diagnosis has to match up with your clinical complaints. If you go there with some neck pain, radiating into the shoulder, then they examine you carefully. Let's just say you have limited range of motion, you can't turn, and you've never had this problem before. Depending on what happened to you, how you develop this, they be able to diagnose. Now, obviously, then the two chief exams that you need is the MRI and the EMG. If you don't have a case, if you don't have a personal injury case, workers' comp case, then perhaps the imaging study would be the way to go. The imaging study of the MRI will be able to tell us if you have a herniated disc or a bulging disc. Now, what is a herniated disc and what's a bulging disc? Well, when it comes to the cervical spine, one of the things that you want to know, right, is you have 8 major divisions when it comes to the spine. Now, a lot of physicians, they say 7, but it's really 8. And so you have C1, 2, 3, 4, 5, 6, 7, and 8. C stands for cervical, and then C1, C2, C3 makes up the top part of the neck. C4, C5, C6, it's like the middle. Or C4, C5 is like the middle. And then C6, C7, C8 is the bottom of the neck. So when they do an MRI, the MRI will be able to tell you the location. Let's just say a very common herniated disc, a bulging disc, is maybe at the level of C5, which is right in the middle of the neck, and the disc is herniated. What's a herniated disc? Now, what happens with a herniated disc? Just picture a disc, and inside that disc you have a liquid substance. Now, when the disc is herniated, what happens? Well, the disc kind of ruptures a little bit, it opens up, and the liquid comes out. When that liquid comes out, you have nerve roots outside that disc. Okay? Right in the parameter, right in the exterior. Then that liquid has a tendency of compromising the nerve. Okay, it irritates the nerve. That's what they call it, a pinched nerve. But I'll be honest with you, I hate using that term, pinched nerve, because every single doctor you see is a pinched nerve. You have a pinched nerve. I think I'd rather receive a better explanation than just a pinched nerve. So, liquid comes out, and it has a tendency of compromising and irritating the nerve. And then you have that nagging pain. And obviously, when the disc is herniated, then what happens? Then you develop compression. You develop that discomfort. that limited range of motion. Now you can't turn this way, or they call you have to kind of just be like, what's going on? And then depending on the location, then you can develop just pain in the neck or into the shoulder or into the arm. Now, what's a bulging disc? Now, bulging disc is a lesser inflammation. Let's just say you got a bump in your head, right? Then you have a little bulge there, and you put ice, it subsides. So a bulging disc is the same thing. So you get a little bulge. So the disc doesn't rupture. The disc still closed, but it's kind of swollen a little bit. It's a lesser inflammation, so sometimes it's not going to irritate the nerve, but it can irritate the neck. It can give you limited range of motion. It's not comfortable, let's just say. And some, depending on your health, depending on your condition, depending on your weight, depending on medical conditions that you have, depending on your posture, depending on how old you are, that could really make the difference as far as what's going on. That's why in this channel we're going to also discuss, how to stay healthy, how to stay fit, how to have good posture, how to have good weight according to your body structure. So when we do get hurt, it's not going to be the end of the world. You're going to be able to handle it a lot better if you weren't in shape. Let me give you a perfect example. Let's just say you're the type of person that stretches, just like an athlete. You stretch every single day. Well, athletes, they stretch for hours. But you stretch 5, 10 minutes a day. And then all of a sudden you slip and fall. You twist your ankle, you twist your elbow or your wrist. What's going to happen? Well, maybe the majority of times, nothing. Because you have good flexibility. You got good bone density. Okay, you've been stretching. So maybe a little swelling, maybe nothing would happen because you have good range of motion when it comes to your bones. That's why these athletes, they stretch. Let's look at these soccer players. I was watching some soccer highlights the other day, and I've seen how many times Messi falls. My goodness, I'm like, I'll take 3, 4 of those falls. I'll be in the hospital, but Messi gets right up. But he's an athlete. He stretches. His body can take that. He conditions his body so he can take these falls, this abuse. All these athletes take it, whether it's football, whether it's baseball, whether it's hockey. You got to take care of your body, right? my throat here. I'm gonna have to drink some water here. We're back. So that's why it's important that you keep your body conditioned. You keep your body in shape, because you don't know when something's going to happen, when you're going to get into an accident. Now, obviously, my specialty, it's in electrodiagnostic medicine. It's the peripheral nervous system, which is nerves and muscles. I examine nerves and I assist on the EMGs. So we do nerve and muscle examinations, EMGs. And I see a lot of patients with these conditions where they come in and they get diagnosed with cervical reticulopathy, and some are in bad shape. Sometimes they need surgery. But when your body's in good condition, then you can take the hit. Well, sometimes, you do need a lot of help when it comes to the cervical compression syndrome. Anyway, so just getting back to the MRI, we pretty much have an idea what a herniated disc is, or what a bulging disc is. So when you get an MRI, those are the most common, clinical diagnosis when it comes to imaging studies. The herniated disc or a bulging disc. Now, sometimes you can have spasms, or it could be normal. Obviously, in advanced situations, you will have degenerative disc disease, but that's another topic. We're talking about when the nerve gets affected, and usually when the nerve gets affected, it's because of a herniated disc, bulging disc. Now, when they do an EMG, right? So usually when I get a patient and and there's been a clinical diagnosis of cervical reticulopathy, then of course what I do is I examine all the nerves that originate from the neck. Okay, so from the shoulder once the nerves pass the shoulder, and we discussed it, all the nerves you have from your shoulder to your fingertips originate from the neck, right? So once the nerves pass the shoulder, they become very superficial. So by attaching some leads, some electrodes, and using electrical impulses, I can stimulate the nerve, kind of take a picture of it, and I can see exactly what those nerves look like, and especially and those nerves that are connected, and those nerves are connected to the neck. So we get a lot of information, and depending on the level of where you have the nerve that's affected or where the nerve is compromised, we can see more or less what nerves could be affected, okay, or the location. Now, but that's not the nerve examination is not the most important test. The most important test is the actual EMG, the muscle study. Now, what happens with the muscle study? The physician, neurologist, or physiatrist, I work with a physiatrist, she's the best in this business. She takes a needle electrode, it's like acupuncture, okay, it doesn't really hurt. She pinches the muscle and records the muscle activity. Now, how does she know if the nerve is compromised, affected? Well, it's really simple. So when your neck is normal, right? There's nothing going on, and you touch it. Like I'm touching mine now. It's nice. I feel my muscles nice and soft. It's not tight. It's not compromised. I don't have any pain. I don't have any limited range of motion. But when you have, okay, when the nerve is affected and you have pain there, it's tight. You get the limited range of motion. You touch it, and it feels very, very uncomfortable. You know that something's going on there. So when the doctor takes a needle in the muscle, it's nice and soft, nice and normal. Then when you study the electrical activity of that muscle, then it's nice and relaxed. But guess what happens? When the nerve is tight there, when the muscle's tight, you stick a needle in there, and there's increased activity, or there's increased spontaneous activity, or increased insertional activity. Okay? The doctor, by sticking the needle in there, can record the electrical activity of that muscle and know what's going on, because she can see that the muscle is not relaxed, and she can spot the exact location of where. And obviously that same doctor already had examined you clinically, so she knows more or less where you might have that nerve is compromised. And if she has an MRI, let's just say the MRI says you have a herniated disc at the level of C5, or maybe a bulging disc at the level of C5, then she can go right into the source. But she could go one above, which is C4, and she could go one below, which is C6, and she can study the exact parameter of that spine, of those nerves in the spine, and can see more or less if it's affecting C4, if it's just C5, if it's going into a little bit into C6, and she really can't make a mistake. So the EMG, which is the needle examination, it's really important when diagnosing cervical reticulopathy. I hope this video has been helpful. Okay, if you find this video helpful, then refer it to your friends. If you haven't subscribed to this channel, well, then consider subscribing. Like I said, we're going to give you a lot of diagnostic information so you and your family can be healthy. We're going to discuss a lot of different topics. Another video we're going to do is lumbar reticulopathy, and we're going to discuss a lot of different medical topics that will definitely benefit you and your family, so we could be healthy. That's the best we could do. Take care of our minds, take care of our bodies. I always tell my patients the same thing, pretty much. The body has two major superhighways. The cardiovascular system, which is the arteries and veins, we got to take care of it. The peripheral nervous system, which is nerves and muscles, we need to take care of it. Obviously, there's a lot more that we could do when it comes to taking care of our health. We got to take care of our brains. We got to take care of our minds. So we're going to discuss a lot in this channel. I think this channel is going to make a difference when it comes to the parameters of people. There's a lot going on in this country as far as health, and we're going to try to make a difference, at least in what we know. So consider subscribing. Turn on your notifications. When we take out our next video, you'll be the first to know. And with that being said, I'll see you in the next video. Bye-bye.